So, you're considering a career as a CNA or starting your career as a CNA, but what exactly does a CNA do? That's what we're going to cover in this video. What's up, you guys? My name is Anissa. I am a licensed certified nursing assistant on her journey through nursing. And in today's video, I'm going to break down what CNAs do on a day-to-day basis and how you can get involved if you're interested, all right? So if you enjoyed this video, please give it a like. If you have a question, leave it in the comments. And if you want to see more content like this, please subscribe. So let's get started. So the duties of a CNA are gonna vary widely, and that's largely because there are so many different environments that CNAs work in. You could work in hospitals, you could work in long-term care facilities, you could work in assisted living facilities, you could work in a rehab. So all of those different settings are going to ask different things of their CNAs. So I'll go through the most common that you're going to find pretty much across the board. But just keep in mind that there are some duties that you might do more or less of depending on where you work. So the first duty is assisting with activities of daily living, or ADLs. So this is basically helping patients do things that they need to do on a regular basis, but have a hard time doing for themselves. This is things like eating, bathing, dressing, helping them use the restroom. So you're gonna help them with the physical support as well as sometimes even the emotional support, just helping them to maintain a sense of dignity in their regular lives because they don't have the same level of independence that they once did. So if that sounds touching to you, or that sounds like something you would be willing to help someone with, then being a CNA might be up your alley. The next thing that CNAs do is monitoring vital signs. So we are usually responsible for measuring and recording vital signs like temperature, blood pressure, pulse, and respiratory rate. So this information is pretty crucial when it comes to assessing a patient's well-being overall. So you'll probably take vitals at least a couple times in a shift. Next is mobility assistance. CNAs, we assist patients moving from their beds to their chairs, moving from their rooms to the dining hall, and depending on how much a patient is mobile is going to influence how much you do and how involved you are. Sometimes all you need to do is hand them their walker and help them stand up. Other times you may need to place kind of like a sling underneath them so that the Hoyer machine will lift them and place them where they need to go. So that really just depends on the facility that you're working at and the type of patients that you're working with. Number 5, providing emotional support. So I touched on this a little bit earlier. You're nobody's therapist, so you don't need to be concerned necessarily about, giving advice or anything. But people feel very anxious, they feel very angry, they feel afraid, they feel depressed because of the situation that they're in. We love our independence. As adults, we like being able to get up and go and move and do what we want. So for a lot of patients, being in a position where you can't do that is very hard. So sometimes just being a listening ear, just sitting with your patients and listening to them is all you need to do, and it's all that the patient really needs in that moment, and you could do that as a CNA. The next step is observing and reporting changes in a patient's condition. So like I said before, we'll do a lot with vital signs, so whatever signs that you get from a patient, you're going to report those. But also if you notice things like a patient's complaining more about pain, or if you notice they've got like redness on their skin, or they're starting to develop a rash or something like that, you're going to communicate those observations to the nurse or whoever is supervising that patient's care and supervising you. So that's an important role, and a lot of nurses rely on CNAs to report those kind of changes because we are the ones who have the most patient contact, and we're the ones who are generally doing things like showers, baths, and changing. So we can see a patient's skin, we can see their condition change much more clearly than they can. So next I want to talk about the differences between being a CNA versus other types of nurses. So there are a lot of different types of nurses out there. Nursing spans a bunch of different fields, but there are three main categories of nurse, or three main licenses within the nursing profession. One is, of course, CNAs, which is a certified nursing assistant. Two is an LPN, which is a licensed practical nurse. And then three is an RN or a BSN, which is a registered nurse. And so we're going to go through and differentiate between the two of them. So first, for a CNA, your education is going to be the lowest level of the three. It doesn't mean you're not educated. It just means that your training is much shorter and less comprehensive. So usually to become a CNA, all you need to do is take a program. It's usually about 5 weeks, but I've heard of some programs that are up to like 3 months. And in that period, that's where you're going to learn how to practice as a nursing assistant. Your scope of practice falls within the skills that I already listed previously, nothing more than that. So stuff like passing meds or doing IV sticks, that is not within most nursing assistants' scope of practice, although it might be different in your state. But in my state, you're not able to do that. Supervision, we work under the LPNs and the RNs, and we take direction from them. So that's where you get the nursing assistant title from. We're assisting the nurses, okay? Next, for an LPN, a licensed practical nurse, or sometimes you hear it called an LVN, a licensed vocational nurse. Their education is a little bit more extensive. Their programs usually range anywhere from, sometimes I've heard, 6 months to a year. 6 months would be something like an accelerated program. And they must pass their NCLEX LPN, or excuse me, their NCLEX PN in order to practice. So they've also got a state exam. Their scope of practice, they're able to do a lot of what nurses can do. So they work under RNs or even directly under physicians. Their duties include administering meds, performing wound care, collecting samples for testing, providing basic nursing care. Honestly, I've seen a lot of LPNs taking on more and more and more responsibility within facilities, almost like what I knew nurses would be doing, and more nurses are taking on responsibility like what doctors used to do. So it's just kind of interesting to see how scope of practice is constantly changing. Next thing you know, CNAs are going to be doing LPN work and LPNs are going to be doing RN work. Don't quote me on that, but that's honestly what it's going towards, it seems. And like I said, LPNs, they work under physicians and RNs. All right, next, RNs. So registered nurses, this is what most people are thinking of when they think of being a nurse. They typically complete an associate's degree, which is 2 years, or even a bachelor's degree. And from an accredited nursing program, and they have to pass the NCLEX RN in order to practice. They're able to assess, plan, implement, and evaluate patient care. They have the authority to perform a lot of different interventions like administering meds, conducting assessments, developing care plans, providing patient education. They do things like IV sticks and inserting catheters. And while they supervise CNAs and LPNs, they also are able to work pretty independently and collaborate with the physicians. So it's a really high level of care that you could perform as an RN. And then you would get like a BSN to become an RN, but you could keep an associate's degree, but the BSN does allow you to, it does open more doors for you to like do more complicated work and potentially keep advancing your career into stuff like a master's degree in nursing or even a doctorate in nursing, which would allow you to become a nurse practitioner.